So every Tuesdays, 9 o'clock, I'll be coming on the YouTube and the Facebook page. But today I'm making use of the YouTube now. I've brought something on health issue. I've been discussing it, and few persons came to me and said, "Why don't you discuss it on YouTube, on Facebook, that we help other people to grow as well?" Okay, tonight we're going to talk about sickle cell anemia. What is it? What is all? What is it? What is the sickle cell? What is anemia in it? This is what we understand tonight. And I'm going to be throwing pidgin and other languages that we understand, though, so that we'll be able to get it clear, so that we'll not make mistake when it comes to choosing a life partner, or having kids, or taking care of ourselves, or going for checkups. It's very, very important for us to do that. What is sickle cell anemia? Sickle cell anemia is an inherited red blood cells disorder in which aren't enough healthy red blood cells, okay, to carry oxygen through your body. So it's that particular part that don't have red blood cells that transport it throughout your system, transport it in your body. So there is a pause. So when there is this pause, that's why we call it sickle cell anemia or sickle cell disease. Normally, the flexibility is around the blood cells. It moves around. That is what boosts your energy to have blood. That is what boosts your energy to want to do other things that is different from what other persons are doing. The essence of we teaching this sickle cell today is very important for us to understand something. When you don't take care of yourself, or for example, you are AS and you get married to an AS person, there is this possibility that something is wrong somewhere, okay? Easily. It travels easily through the red blood cells vessel. In sickle cell anemia, the red blood are shaped like circles. That's why it's called sickle cell. It is shaped like circle, crescent moon. So when you look at the map, when you look at the way the sickle cell anemia is being designed, so it's a circle. So because it's a circle and the blood does not travel around, so it becomes so is there. Can it be treated with transfusion, only blood transfusion, in the sense that that blood will be washed out, okay? The carrier, AS is a carrier, SS is the one that have sickle cell anemia. Listen, it's not a funny topical. It's not a funny thing that we should just neglect. It is something that we really need to talk about. And I've made it a point of duty that every Tuesday, 9 o'clock, will come on this YouTube and other device means for us to know about health issues. Different type of health issues will be coming up with it, okay? So it can be treated with blood transfusion. In Africa or other parts of the places, they have injections, they have tablets. It is not workable like the one that is on one. Good evening, Entertainment TV. God bless you. God bless you, sir. You are welcome. You're welcome. Please invite your friends. We're going to talk about sickle cell anemia. It's a very vital topic for us to talk about, for us to be able to help people around us, okay? Now, we are talking about treatment. Even when we talk about a blood transfusion, do you know that not everybody can afford it? Here in Europe, it's so expensive. Only one flush is about 2,500, 3,000 euros to do the blood transfusion. And it is not what you just do once and you leave it. It is what you will come often to do it 3 months. So how will you get that kind of amount to do that? So precautions need to be taken for you not to make mistake. Precautions need to be taken. And the symptoms is so painful, too painful for us to know about. Thank you, JJ's and C family. God bless you, man. You're welcome. You're welcome. Thank you so much. You're welcome, welcome, welcome. Today we are talking about sickle cell anemia, the sickle cell disease, or that we all know SS9. We are going to split it in a way that we understand that even when we are getting married, you must go for tests. Don't say because of love. I'm not saying don't love. Oh. Love is permitted. You can love. But there's something I want you to understand. You can love. But it has brought a lot of children into pains. It has brought a lot of, even you as a father or a mother, you are bringing those children to this world for them to suffer. You are bringing them to this world for them to suffer. Imagine the pain. Imagine the pain. If you see where a sickle cell child is, you will pity for that person. People have been prominent. People are making it. All of a sudden, their life is being cut short because of the career or because of the AS they are. Be careful. Love, they say, is good, but be careful who you trust. It doesn't really matter. For instance, they say that out of all your children, probably one or two might have it. If peradventure all of them has it, what will you do? Have you feel that moment when they enter pain? Can you be able to control it? Can you be able to walk with them? Sickle cell anemia is a painful sickness. Thank you, my sister. It is a painful sickness. I have seen and have witnessed. Sometimes it is not you that is carrying it, but you will cry for them. You will cry for them. So please, it's a topic that we will not neglect. And we are going to be coming with series to talk about it, to get about it. It's very important for us to talk about it. Very, very important. How do you get sickle cell anemia? Most people will ask, I don't have it. All of a sudden, I marry someone, the person has it. So how do I or the child contact that sickle cell? People who have sickle cell disease inherit one sickle cell gene. If the father has it and the mother, for example, both of them are AS, there is the possibility that a child will carry one of the gene from it. A child will carry from it. Is it that from one of the parents? They will have a normal gene. And that's why it said AS. S is for the sickle cell. The A is a carrier. They carry the sickle cell. So the proper sickle cell anemia is the XX we call about. But I want you to understand something here. AS, man, woman, AS, there is this possibility that your children, if probably not all, even one, will carry it. Have you not thought about it? That many souls have been wasted away. Have you not thought about it? That lives have been cut short. At the time that they are making it, and the time they are progressing, and the time they are getting to the top, their life is being cut short. Haven't you noticed it? So why taking through the pain? Imagine when you are pregnant, is a precaution that needs to be cared. To give birth to that child is a special treatment, a special attention. Why don't you avert it now? If you avert it, it is easy for you to work out with it. Okay? It is a normal thing that they will carry from the parents. A is from other parents. This is called sickle cell trait, SCT. Sickle cell trait. People with sickle cell trait usually do not have any of the sign of the disease at all and live a normal life, but they can pass the trait to their children. Okay, so this is very simple enough. A normal man or a normal woman walks around the streets not knowing that she is a sickle cell trait, and lives a normal life, haven't fall sick. They don't give them special food, no special treatment, because he or she has not fallen prey to that. But there is something, if he marries somebody that has a career, there is a possibility that you will give to your children. Okay? You will give to your children. But they can pass it to the child. They can pass. It is a very painful thing. No, it is a very painful thing. When you see them crying and roaming on the ground, you that don't have it, you will just pity for that person. You will pity for. It says stem cell or bone marrow transplant are the only cure for sickle cell. Here in Europe, I've witnessed some. It is being flushed out. They go to the hospital, they take the blood, the sickle cell blood, they put a pipe in it and they flush it out. So they'll be able to like remove the traits of that. But do you know that it's not a normal treatment? It's not a normal way that every one of us can go with it. It is money, it is time, it is energy, and it is strength. Can't you avert it? Simple enough, we can really avert it. Okay? So, we move on. So, the only reason they can do the blood transfusion, thank you so much, Praise TV. God bless you. You're welcome. Okay. Oh, thank you so much, JJC family. Thank you so much. It's an interesting topic, and at the end of the conclusion, we are going to see the needful for us to take what do they call your test, the blood test. Don't say no. I already know myself. And sure, my mom and dad, they are good. They don't have anything. I'm sure I've not fallen sick. Hey, that is what we just heard now. The SCT is a sickle cell trait. They carry, they have it, but they've not felt the sickness. But they just, thank you so much, Chris TV, for sharing me out. Thank you, family. God bless you. Thank you, everyone. I'm indeed honored and appreciate every one of you in the name of Jesus. Okay, thank you so much. Okay, thank you. So we go on with it, and it says, so the only thing that it can radiate the blood sickle cell anemia is the bone marrow transplant. Is another cost, another money, another energy. Transplant is the only cure of sickle cell disease. But in everything we do, there is birth. But they are not done very often because the significant risk involves stem cells and special cells produced by bone marrow, a spongy tissue found in the center of some bones. There are some bones that they remove all those things and they want you to pee through and you are okay. So it's very, very important for us to understand it. You have a partner, the first thing, don't allow only the woman to go. Some men will say, for me, I'm okay. I'm pure, nothing happens to me. You as the woman, go and do HIV test. Go and do this one test. Go and do this blood test. But you as a man, what are you doing? Or you as a woman, you begin to like, you have this confidence about yourself. That is not about confidence. It is about you going for tests so that you don't bring innocent children to this world to face pain from day one of their birth till when they die. No. So proper checkup needs to be made. Special treatment needs to be taken before you even do. But my advice, this is what I know and have experienced, is if a AS is better just avoid it. I know it's painful when you love someone. Very, very painful. When you love someone and you want to be with the person. But it's a risk because you are bringing children to this world that will not have this profit, what they can do. Okay? It's a risk. It's a risk. It's a risk. It's a risk. Can a sickle cell person have a baby? Yes, of course, they can have a baby. Can women with sickle cell disease have a healthy pregnancy? pregnancy? Yes, of course. They can, with early prenatal care and careful monitor throughout the pregnancy. So the fact that we say, yes, you are a sickle cell carrier, that your pregnancy will be smooth. We are saying, yes, you can carry a smooth pregnancy, but you need to be monitored from day one till when you give birth. There are some cases they have been placed in bed rest for them to, for the pregnant woman, that yes, you can carry pregnancy, but be sure that you are being monitored, be sure that you are controlled, so that you yourself will be at risk carrying that child, okay? With prenatal, don't go to quack doctors or quack chemistry, or quack just where the pharmacy, or where they just give you tablet and wrap it in paper and you are good to go. Go to the proper prenatal care for you to be taken care of. By so doing, you are good to go. You are very good to go, okay? Throughout the pregnancy, you have to be monitored. A woman with sickle cell disease can have a healthy pregnancy. However, women with sickle cell disease are more likely to have problems during pregnancy, are more likely to have problems during pregnancy that can affect their health and that of their born child. So when you are not being taken care of, you don't take care of yourself, you don't eat the proper food, you don't, whatever you take in, that is what the child takes also. Whatever that you take in, that is what the child takes in. If you have been where sickle cell person grew with you, if you have been and seen the sickle cell patient, you will just as if, why is the parents punishing this person? No matter how wealthy that person might be, the life is being cut short suddenly, unexpectedly. So it's very important for you, yes, a woman that has sickle cell disease or anemia, yes, you can get pregnant. You can get pregnant and carry it through full term only when you are taken care of. Make sure you take care of yourself. And I still repeat, anyone comes to you as a man, I want to marry you, I want to do this, I want to do this, I want to do this. But let me tell you one thing. The first thing you must tell the person is to say, the first thing you must tell the person is to let the person understand that we have to go for test. It's very, very important. We have to go for test. If the person runs away and the person is not meant to, okay? So not only the women on the men's side, you are so confident about yourself, the other partner, you can do whatever you want to do. For me, I'm okay. Okay, because I demanded some questions and somebody sent me a question. Can you get sickle cell anemia from kissing? Amen. Okay, so we are not in church service, but I want you to understand something. No, you cannot contact it. No. Sickle cell disease is not contagious. No. So you can catch it from someone else or pass it to another person, like a cold or an infection or other infections. But for kissing, no, it's not contagious. So you can go with your normal life. But that is not a yardstick for you to go kissing everyone around your neighborhood, or in the name of looking for love, or in the name of you want to have someone around you. So be careful who you move with. And I pray that will not fall victim in Jesus' name. Okay. How can a child have the sickle cell anemia if neither the parents has it? Okay. So this is what we talked about before, that the sickle cell trait can be in the blood of, it's either the mother or the father. But when it comes to both parents not having it, and you find out that child has it, something is wrong somewhere. Your child could have to inherit two sickle cell germs to have sickle cell disease, okay? So if your child's father does not have the sickle cell germ, your child can't get it at all. It cannot get it at all. But if your child's father has the sickle cell germ, your child can get sickle cell disease. So this is what we talk about, the LCT, the sickle cell disease, carrier cell anemia, or the traits, okay? The SCT. One thing, your child cannot contact it. Your child cannot be a carrier of sickle cell anemia or disease, whatever we want to call it tonight, but they cannot get it. So if it happens that your child has it, there's something is wrong somewhere. Both of you need to go for checkup. Both of you need to go for blood test. Both of you need to go for the necessary checkup, not only on one side. And I just believe that my family, myself, we are just healthy from the one to this time. So if both of you are not having it, none of you will carry it. And your children cannot carry it. No, they cannot carry it. No, they cannot carry it. So then if the child carries it, then the parent have it. So it is very important for us to know what it's talking about. In a nutshell, we are just trying to avoid what it will be called disastrous later. Will I pass sickle cell disease onto my children? Sickle cell disease runs in a family. If a mother has it, you get pregnant, you will have it, the child will have it. That is, if both of them, or if it's only you and the other person is not having it, so there is no risk about it, there is no cause for alarm. Okay, but if one of you, for example, both of you are AS, there is a possibility that your child will be a carrier, will be a sickle cell trait. Okay, so yes, it can be passed to your children. Sickle cell disease runs in the family. I don't have it, but my friend told me something. Now they pass to the children, and that's true because one of the partner has it. So if one of you have it, you'll be able to pass it to your children. So be careful. Be careful. Be careful who you meet. Be careful. And be very open. When you are in a relationship, be open. Be open. Let them understand you. Let them know where you are coming from so that people can be able to help you. Okay? Sickle cell disease is an inherited blood disorder. Children can inherit only one sickle cell gene from a parent. They have sickle cell traits already. They usually do not develop symptoms of sickle cell disease. It is in them, okay? Because they already have the trait. But if one of the parents have it, then they can carry it, okay? Inherit two sickle cell genes, one from each parent. They have sickle cell disease and we need long-time medical care throughout their life. They will be on bed rest throughout the life. Even their studies will be cut short. Even even whatever they lay their hands, it will not be properly handled because they are sickle cells anemia. So we should be very careful. Whatever we are doing, we should be very careful where we are going and where we place our feet so that we will not make mistake. You can find out if you carry the sickle cell gene with a simple blood test. Blood test. We live in an advanced world where you can easily do the blood test and it will help you. It will help you and it will help you. It will help you really good, okay? If you do not have sickle cell trait, doesn't mean your kids will not have cell disease. Your child will have to inherit two sickle cell gene to have sickle cell disease. So if your child's father does not have the sickle cell gene and you do, there is a possibility that your child or children will have it. On our next segment, we're going to talk about the pains, the cure. That we already said the only cure is bone marrow transplant. That is what we can use in treating or blood transfusion. So if you don't have the money, why don't you take precautions? If you don't have the money, you don't have the time, you don't have the energy, why don't you take precautions? So lastly, before I go, be careful who you move with. Ask questions. Be free. Don't say, I don't want to lose him. And I pray we will not fall victim into the hands of wrong people that will cut our destiny short in the name of Jesus. Be careful and be warned. Be careful and be warned. Sickle cell disease anemia is real. Is real, is real. So be careful. Thank you. Thank you. I'm your host, Loretta Falodun, Mrs. Loretta Falodun. So see you same time Tuesday. Every week we're going to be talking about healthy living on this very program. Thank